WGAW. Hi, everybody. Steve Wendell here on WGAW, and we have a special Hotline Radio program here, basically to go over how Gardner and Heywood Hospital reacted to the COVID-19 coronavirus pandemic, starting in January 2020, thereabouts in our region. Let's go first to Dawn Casavant, Vice President of External Affairs, Government Relations at Heywood Healthcare, to find out how did the healthcare unit react to the pandemic? What all started?
Well, I think that our initial reaction was to pull together all of the various departments and various systems that are at play when it comes to delivering healthcare to a community. And so internally, from an internal perspective, we immediately launched our command center, by which there are a variety of roles and directors and leadership that represents all of the various services, like I said, from facilities to environmental services, infection prevention, direct patient care, surgical care, because when you have an incident pandemic of this magnitude, all areas are impacted and one impacts the other. So pulling together to understand on a daily basis, we had command center originally, there was command center open all day long, and then we dropped it down to twice a day and then to once a day. And believe it or not, still today, we start every single morning at 8:15 with a leadership call and a check-in from all the various departments and areas of our health system, so that we are all on the same page at the beginning of each and every day. So with that, there was a lot of work to be done. There was a lot of information to gather. There was a lot of information to share. And from the get-go, our strategy was transparent communication, because we felt that frequent communication and transparency really were key to keeping our community informed and to keeping our community on the same page and trusting, the care and the information that was forthcoming. So we originally began with 3 video updates every single day to the community via our social media, and then we went to twice a day, then we went down to 3 times a week, and then when things sort of started to get into a normal routine, we went down to once a week, which is where we are today. And I do think that we are probably unique in that respect, in that we did share an awful lot of communication. We shared communication as it was received, and it changed frequently. And I think it's a testament to the community putting their trust in us also, that as information was coming in and was changing frequently, there remained a good level of trust and support. And I think that the outpouring of support was incredibly appreciated and apparent through the community sewing, bringing goods and services, organizing a prayer vigil in which our parking lot was completely full. And folks were praying when we had our very sickest patients in our ICU. And just that outpouring of support, I think really, I know, meant an awful lot to the community, an awful lot to the health system.
And Dawn, I know that Heywood Healthcare also, all the nurses, extra doctors that you had there, the cleaning personnel, the food personnel, people all chipped in amazingly.
There is no job, honestly, that wasn't important. And it is true, but this really just highlighted the fact that each and every position that takes that is part of our health system is incredibly important to make it all work. And without our food service, it doesn't work. Without our environmental services staff, it doesn't work. So absolutely.
And Heywood Healthcare coordinated very closely with the city of Gardner, with Mayor Mike Nicholson and Lauren Saunders, the Gardner Director of Public Health, kept the communications open. Lauren, how did it impact the Gardner area, specifically with public health in the area. You got right on the issue.
Yeah, it's not something I was expecting to tackle, but it was here. It was in our face. We didn't have a choice. We had to deal with it. It consumed, I would say, 80, 85, 90% of my day for the past year. Because, I have a lot of different hats that we wear. We do food, we do housing, we do all kinds of different safety, but this was our day, like almost 100% of it every day for over a year. So it was super, super helpful. I cannot say enough about having Heywood Hospital as a partner, having the CHC, the other health directors. We met weekly. We would talk about getting vaccine. That was a huge challenge. I know that originally we thought maybe as health departments we could get the vaccine, but it just was not coming to us. So having Heywood to get that vaccine was like an integral, huge part of our success, like absolutely. We did a lot of enforcement. We had to, do compliance checks. We got a lot of calls, lots of complaints. We had to make sure businesses were operating safely. Another big thing that we focused on is just like trying to help people navigate those rules and regulations because, we had multiple meetings every single week with the Department of Public Health, Department of Labor Standards, and those rules and regulations and guidelines were changing daily, sometimes hourly. So trying to stay on top of all those and help the community navigate those rules and regulations was a huge, huge part of what we did.
I know you communicated very well with a lot of the businesses and the public areas to make sure everybody was safe.
Yep, that was the goal. We tried to keep communication, like Dawn said, it's so important, transparency. We would share Heywood things. The mayor was doing his updates. We would share those. There was a lot of oversaturation, lots of information, but I think that was super helpful to the community for sure.
And Gardner Mayor Mike Nicholson, you had pre-set up, I guess, Gardner High School originally as a vaccination clinic, but then changed. Tell us about that.
So I should say too, is I didn't start in my role during the pandemic. I was over in Rutland until the elections finished. I got sworn in on July 14th. So a lot of what got Gardner under its good foundation, I do have to say a special thank you to the two acting mayors, Jim Walsh and Lizzie Kaczynskis for funding. A lot of people didn't realize that back in 2001, after the September 11th terrorist attacks, it was actually mandated by the CDC and the different state public safety agencies that every city and town maintain a mass inoculation plan so that in the event that there was something that happened, and back then in 2001, 2002, they all thought it was going to be a bio attack, we would have a plan in place. That way you can just press go should they ever have to have some type of mass vaccination. So we had been drilling our max event high school for a year since 2002. But then when you sit down, practicality is a lot different from theory, and paper is a lot different than practice. And that's something that really kind of got highlighted there, in that when you're driving around the high school, yes, it's a big piece of land and there's a traffic flow to it. But what if there's a reaction to someone who got the shot who's now behind the wheel of an automobile? What if there is, someone who tries to just drive through the security thing because they're so nervous that they have, a panic attack and they just want to get through, even though they're not supposed to get the vaccine shot or something may have turned them away. So really having those discussions with Heywood Hospital about the different locations, we looked at 3 or 4 different locations. Correct me if I'm wrong, Don, on that one, but we looked at the field house at Mount Wachusett Community College and converting their gymnasium into a vaccination center. We looked at the old Fashion Bug location over in Timpani Plaza with CBRE properties. And then we finally settled on the PACC just because it was a ballroom that currently wasn't in use. The club had no activities going on because they couldn't have any activities going on. They had plenty of parking. They were a place that people were familiar with. And quite frankly, it was on the border with Templeton. And we knew that the state was going to prioritize regional clinics. And we knew Heywood's catchment was a lot more than just Gardner, but it's the North Central Mass and North Quabbin region. So by, just having those discussions, we adapted and we had the plan ready to go. Yes, we may have been drilling on this one thing, but we were drilling on something that we were like, oh, this may happen one day, but we're never going to have to do that ever. And then when we got to it, we're like, this may have been what we're drilling on, but we're drilling with 5 people who have been assigned a specific scripted role, not someone who's having an emotional or mental connection to what's going on. And we had to adapt. And I think we did it excellent. I'm really proud of what we were able to accomplish over there.
I know Mayor Nicholson and also Dawn at the Heywood Healthcare coordinated very closely with the Paul Topolski, the Director of Emergency Management and Civil Defense, to get the vaccines to Gardner. Dawn, maybe you could coordinate. Tell me about how that coordination went. You were very instrumental, along with the Director of Public Health, Lauren Saunders, in getting enough vaccinations to really distribute very quickly.
So, our vaccine allotment, it was lagging for a period of time. I think that what we were able to do is we were able to lift a clinic in very short order. I remember going to visit Southbridge's clinic and the next week saying, okay, our turn, now we need to get this in motion. So just getting the infrastructure in place first, I think, was our primary goal. And the vaccine was limited across the state. So we were able to get shots in arms, I think, on short order, and then to continue to demonstrate our capability, which then provided us with additional vaccine. So you needed to utilize that vaccine within a certain period of time before you would get your next allotment. So the ability to be efficient and to administer it was key in our ability to get additional vaccine. And we began with both Pfizer and Moderna, and then we had switched over to only administering the Pfizer vaccine.
Now at the PACC, Dawn, too, you mobilized a lot of people at that PACC. Tell us about that. You had nursing students, you had retired doctors, you had the staff from Heywood Hospital, you had City of Gardner people all involved at the PACC clinic.
Right. So first, we can't talk about being at the PAC without talking about the leadership of the PACC, because they were absolutely responsive, wonderful partners. There at every turn, can we get in? I know it's 9 o'clock at night, but we just thought of something else we needed to do. They were there at every turn and helped all along the way, as did the City of Gardner. We could not have done this without that level of partnership from the administrators, the boards of health for Gardner and all of the surrounding areas, the DPW, our local law enforcement. There are so many arms that made this a reality that I fear to name them, that I'll leave someone out. Our clinic, I think, was also unique in that there were so many volunteers, which enabled us to operationalize again more quickly than probably most, because we had our retired physicians. Again, we have so many people from the community. We're a community health system. We're a community that's used to bridging our resources to make things happen. So our retired physicians, John Harrington, John Scripsack, and our active physicians. So physicians who are currently practicing their days off or their afternoons, they came down to the clinic. Our retired nurses, partnering with the nursing program at Mount Wachusett was also really instrumental in our ability to get started and to continue. And then just professionals and average citizens from the area came together and volunteered, some of them more than 30 hours a week from February 2nd to June 24th. So, I mean, that is a testament to people understood that we all understood from our staff, from the hospital's perspective, and the community. I think we all realized we're in this for, the greater good, and something that was really historic in nature, and everybody wanted to get back to our normal. But I would like to tout Paul Topolski for his communication efforts in that call center. Because we're a health system and we were not eligible for the registration system that the state had to offer. So Paul and the IT director from the city really pulled together to create a registration system that was fielding on some days, Paul, correct me, but originally, I mean, they were in I would say, 20,000 calls a day?
Now, our peak day was 57,000 calls, and we had available 300 appointments. So with 20,000 people in the city of Gardner, you know, it was a very widespread effort for people trying to get in here and get a vaccine.
So communications were unbelievable, and we really thank Paul for everything he did to coordinate and to communicate the ever-changing schedules.
Yeah, Paul, let's get into that a little more detail if we could, please. Now, you started the call center and you got calls from all over the state, the Commonwealth. You also had people trying to sign up online from New Hampshire, Connecticut, New York also. Tell us about how you expanded and were so flexible in getting the call center up and running, because as Dawn said, you had over 50,000 calls some days.
Yeah, it was a very interesting lesson to learn. Originally, when we met over at the high school, Lauren had asked us to create a list of assets that we could bring to the game. And one of the things that we put down, or that I put down, is that we had an emergency operations center. We had 24 phone lines. We had a minimum of 7 answering points inside the EOC. And once we reiterated that, then we realized that would be something that would be important for our senior citizens. So we plan on opening a call center for seniors who did not have internet access. Well, with an average of 900 available doses, they would literally go out on the internet, and those appointments would be consumed in just a matter of minutes. So we took a small portion of those, usually about a third, and dedicated them to the call center. Well, after a few minutes, when all of the online appointments were made, then people started calling the call center, whether they had internet access or not. Remember, our primary customers were to be seniors who didn't have internet access, but it turns out everybody used it, and it became very frustrating because we got a lot of busy signals. When we were using the EOC phone system, that was part of the police department phone system, and we severely hampered their efforts on their business lines. So consequently, we then got a virtual PBX, thanks to Bob O'Keefe, our IT manager, and the mayor's signing off on it. And that got us off of the police system so that they could conduct their normal business operations. And then we found out that the virtual private branch exchange, or virtual PBX phone system that we were now part of, that activity was so heavy, we were severely impacting the rest of their customers. Again, with 57,000 calls in a day, that's a lot of their resources that we were consuming. So consequently, we decided that we were going to limit it to a maximum of 70 people can call at once. What we had in a call queue was 25 people plus the number of call takers we had in a day. So roughly half of the people that called if they're all calling at the same time, would get a busy signal from their carrier, from their phone carrier, Verizon, AT&T, T-Mobile, and so forth. They would get a busy signal. The other half, 25 of them, would make it into the call queue, where we had an auto attendant to answer the phones and say, "Hey, you've made it in, don't hang up. We'll be with you shortly." And then, of course, we had the actual phones, the actual callers that were on with the call takers. So it was a very valuable lesson, and it gave us the opportunity to obtain this phone system, which is now a regional asset. So we can deploy that to other communities should they have a very short-term emergency need. So it was a great system. It was a great lesson learned, and reacting as quickly as we did, I think, was a major benefit. And as Dawn mentioned, we have to thank the city IT manager, Bob O'Keefe. The state had a website. The website was hard to get into. At times it crashed, where the separate website that was created by Bob, it never crashed. It was always there. unfortunately, we would run out of appointments just due to the lack of available vaccine. But it was always up and it was always there. And after that first week, and when we got the PBX, the virtual PBX online, then that whole operation smoothed out. I know it was very frustrating for a lot of people that couldn't get through, but mind you, we've got tens of thousands of people trying to get a few hundred vaccines. So we did the best that we could with it. And all in all, I think it's a good model, and hopefully the state will pick that up for the future. And we've got another emergency management meeting coming up here in a couple of months. And I'm looking forward to be able to present our system to the rest of the emergency managers in the Western Mass section. So we'll see what happens with that, Steve.
And Paul, tell us about you're getting calls. You got calls from all over the state, all over New England, and a lot of people took advantage or tried to get into the online system on the web. Tell us about that.
Yeah, well, the online system on the web was a separate system from the state. You had to go in through the City of Gardner website, and there were direct links to get in. Once you got in, you would pick an appointment time and sign up there, and you would have your appointment confirmed. We had people as in state as far away as Lenox and down on the Cape. I think we had Easton down there. Look at it this way. It's a 2.5 hour ride, no matter which way you look at it, to either one of those locations. So those people were driving 5 hours to get a vaccine. Plus, once they had the number, then we had people from New Hampshire and Connecticut coming in to get vaccines as well. We were so good that people were coming back early from their Florida stays, the snowbirds, coming back to Gardner to get a vaccine because they were even having trouble getting it down there. So it was a very widespread and well advertised system.
Steve, if I could add too, I just want to commend Paul and Bob O'Keefe as well. If you remember, there was we got a couple of days notice that the State Department of Public Health was going to allow people between the ages of 65 and 75 to become eligible to get the vaccine, And that was going to open up eligibility for just over 1 million people statewide. But that was also the day that the state was launching their own call center and their new registration, pre-registration sign up, if you will. So we had already had our registration system running. We had already had our own call center running, and we weren't connected to any of the state's systems on that. And the day that 1 million plus people became eligible to receive the vaccine, all of the state systems crashed. And the only operable registration system statewide was Gardner's registration system. And that's completely thanks to everything that, Paul and Bob O'Keefe and just the people behind the registration process just had ready to go, that when it came time, they just hit the button and it was ready to go. And that's the same thing we've seen throughout Gardner's response and the area's response to the pandemic. Is we had a plan in place. And if you don't plan, you can't expect to do well. We planned and we did well. And I think it comes down to that. But that's the one thing I don't think I'll ever forget, is that the entire state, the only place that was operable and up and running was Gardner.
And yeah, you also, Mayor Mike Nicholson, helped to coordinate with Paul Topolski, with state officials, with the emergency management people, along with Lauren Saunders, the Director of Public Health. Very good communication with the state with different issues, correct? Tell us about that.
Yeah, there was one time we thought that Gardner's clinic was going to get shut off when the state was consolidating clinics. And I remember it's somewhat of a panicked phone call, Zoom call, with some people from the hospitals and the area town administrators. And the response we got was, no, Gardner's doing fine. We're going to keep you open. And that, again, the state had set the bar here for everywhere else and then said, except for Gardner, because they just know what they're doing. And you look at Rutland, because that's what I'm familiar with, because that's where I was working on the plan before I came here to Gardner. And they were also marked as one of the high efficiency clinics in the state, but we're told you need to change your operations to allow for this. When it came to Gardner, Gardner was told, just keep doing what you're doing because you're doing exactly what you need to be doing. And that's because we were able to continuously have this communication. Paul was always great reaching out with the emails and giving us the daily updates as to how the call center was running. Lauren and Don were telling us how, the boards of health were responding, what the vaccine supply was. And we kept it going with Representatives Lotnick, Senator Tran, Senator Goby, Senator Ferguson, Representative Ferguson, Representative Whips. We would have periodical phone calls with each other to make sure that the supplies were coming in. And we even had the federal legislators, Senator Markey and Congresswoman Trahan, come to the clinic because they heard how efficient our clinic was running. The governor was going to come out the day that he stopped by Lee's hot dog stand, but because he got stuck at Lee's hot dog stand taking pictures with everyone, his schedule ran over, so he wasn't able to stop by. But things like this, Gardner was like, the state knew what Gardner was doing and was asking questions as to how we were doing so well with what we were operating with, because we just blew their models out of the water. And that, again, is just a testament to the strong partnership we had with the PACC, Heywood Hospital, and the city, just in all our different factions underneath us too, in making sure that we were communicating with each other so that if one person was saying one message, that message was going through everyone else in the same exact wording and manner. I don't know how many times Don and I exchanged scripts with each other for different video messages that Wynn and I were putting out, and then the PACC would share everything that we put out too. So again, it's just getting that same message out there.
And to add to that, if I may, the boards of health from all of our area communities, we would meet every single week. And we would have to make sure that we had that consistency in strategy and that consistency in communication. And we used it as brainstorming sessions. And I also think that, this region is unique because everyone here is willing to do whatever it takes and however long it takes, and put in any hours that it takes, and communicate, constantly, and to make it happen for the best interest of the community and the region at large. So I think it was a monumental task, but a monumental testament just to the region and those who represent it.
And Lauren Saunders, maybe tell us about the regional coordination with the other public health departments. How many other Department of Public Health areas did you coordinate with?
So Gardner is part of the Montechusett Public Health Network. So we are 13 communities in this area, Leominster, Fitchburg, Gardner being the bigger cities, and then we have the smaller surrounding towns. It stretches all the way to like Sterling, I think as far as Phillipston, Templeton, that area, Athol. I believe Athol is the most west we get. So yeah, it's a large span of communities, and everyone was always on those calls. Everyone was always communicating. I know some of the towns and cities did smaller clinics. They weren't able to have the capacity or do the volume that the PACC was doing. But again, the PACC was open to everyone, and that was always made very clear that all these different towns that were maybe struggling to get the vaccine could definitely let their residents know that the PACC was always open and available to them, which was awesome. And while I have the floor, I also want to mention that we were able to get a homebound vaccine clinic up and running. And again, with partnerships and throughout the community, our fire department, emergency management, and the Woods ambulance, they had teams that were going out. We would do the scheduling. We had the call center that they were available to do screening for us, because there was a list of very specific questions to make you eligible for an at-home vaccine. And we were able to do that as well, which was awesome, because a lot of the smaller communities and stuff didn't have the capacity. But we were right there out front doing the homebound vaccines. I believe we got 15 people vaccinated through the homebound, which doesn't seem like a lot, but it's 15 people that were not able to leave their home. So we were able to get the vaccine to them.
And in addition to that, the community health center, we'd be remiss if we did not acknowledge their involvement. They were involved in every single meeting. They held their own clinics. And were part of the strategy. So we knew who they were targeting. They knew who we were targeting. And sometimes we worked together to do some other in-home services as well.
And
yeah,
also,
we did housing initiatives. Sorry, I didn't mean to cut you off. But we did some senior housing clinics. So we did all our Gardner Housing Authority. We did the high-rise. We did the smaller location on Blanchard Street. We were able to go to the Heywood Wakefield apartment building. So Heywood Hospital was able to secure those vaccines for us. And sometimes they staffed it. Sometimes we had the Wachusett Medical Reserve Corps come out, and they were able to staff it. And it just all went really well. I know some volunteers that came to staff one of our clinics said it was one of the best run clinics that they had ever volunteered at. So we got great feedback. Overall, I think it was just super successful.
And Dawn, the vaccine actual inventory, when a unit could not use all of it, you coordinated for the distribution in the area too, along with the city of Gardner, to get the vaccinations out to other clinics, other healthcare providers. Tell us about that.
Yeah, there was a good deal of sharing. There were quite a few phone calls. We could use 50 doses. We could use 100 doses. Can you spare 30? So we worked together, and we shared with each other. Sometimes we were the ones who were a little bit short. So it was a good partnership and enabled because of that communication. But I just wanted to add, if I could, just the tenure of our clinic, because I think that we would be remiss to end this call without talking about what that clinic felt like. So it was a very positive atmosphere, which I think sort of helped spread the popularity of the clinic. And, as people were getting their vaccinations, they were thrilled. Particularly our first group of people that came through, our elders, were incredibly grateful, incredibly excited. And, it was a jovial, charismatic atmosphere. And music was playing of their era. So every time the state would enable a different age group to be vaccinated, we made sure music was playing. We had goodies, and it was a really uplifting environment, I think, as well.
And now the clinic, of course, at the PACC was closed on June 24th, and all of the vaccinations then would go to state facilities around the area if people still want to get them. And then also vaccinations are also available at some of the pharmacies, some of the businesses in the area, and also private doctors too. Mm-hmm. So they are now all geared up in case other people need vaccinations too. Paul Topolski, tell us about the coordination each and every week, sometimes on a daily basis, with the state officials too.
Indeed. One of the important aspects of emergency management is to assist our financial departments in getting reimbursed for any funds that we would be eligible for disasters. And when this started out, we knew that was going to be a big job. We were looking at a 75% reimbursement for any eligible costs, which has been changed to 100%. There were two tracks for funding, one of which was, of course, through the Federal Emergency Management Agency, the other one through the CARES Act. And we wanted to get as much cost through FEMA that was possible, and then all the other costs. Let's say, for example, just as an example, if you go into City Hall, you'll find protective screens or plastic up on the in the treasurer's office and so forth, or the necessary steps to cover. Make a safe environment for voting and so forth. Those would be CARE Act costs. And then all of the first responder costs, all the personal protective equipment, decontamination equipment, and so forth, and any overtime that the first responders had to spend would come through FEMA. So we're still in process of getting those costs reimbursed, but we're expecting to come out with that and not have COVID-19 negatively affect our budgets or our numbers for what it costs us to do that.
And Steve, so, Mayor Mike Nicholson, if you could tell us too, the accounting, the paperwork, still, if it's 100% reimbursable, there's a huge amount of paperwork for the feds and the state that have to be coordinated with and submitted. And who does that at City Hall?
So that's what I was just going to say. I think Paul is being a little modest here with just how much of a lion's share of the job that he did. We really wouldn't have been able to keep track of half of the financial stuff if it wasn't for the work that he was doing, talking to FEMA. Between him and our city auditor, John Richard, overseeing, the CARES Act expenditures, those two really, the paperwork that's there, like Paul was saying, it was Christmas week. Again, this is another one that just sticks in my head. We had an on-duty firefighter who came in to fill a shift of someone who called out because they took a personal day, find out at the station that his COVID-19 test came back positive. So our whole shift of 8 firefighters at that point had to quarantine. So the overtime for everyone who came in to fill that shift and then who had to cover for that shift for the next 2 weeks until all the COVID tests came back, all had to be, the timesheets for those individual employees for that week had to be submitted on an individual basis. So Officer X's timesheet had to be submitted on top of Officer Y's, and A through Z's, and everyone else's timesheet had to be submitted individually so that they could see that this person used this many hours at this rate of pay of overtime. So you had to submit paperwork on documentation on documentation. Now that's just one example. We purchased $225,000 worth of PPE for Heywood Hospital and another $150,000 of PPE for the Community Health Center. We got all the different barricades for the countertops here in City Hall so that we could open. We got brand new disinfectant machines that are basically a backpack, and it looks like a Ghostbusters machine that you have, but really it's spraying the disinfectant throughout the building on an electrostatic basis so that it really did cling and disinfect everything and you didn't miss a spot. A lot of this, you may not realize how much paperwork is behind it, but it's invoices, proof of payment, different documents, and there's stacks and stacks and stacks and files of the documentation that the federal government requires for reimbursement. And that doesn't take that short of a time to do. So really, Paul on this call and then our auditor, John Richard, you can't thank them enough we got just over $1.8 million in the CARES Act. FEMA didn't have a cap on it for a while, but then they added an additional $40,000 in a different FEMA grant. We just got notified that we're getting $6.2 million in the American Rescue Plan fund that we're getting. So again, this is all this different grant funding that we're having for the next 3 years, that all of this reporting is going to have to continue for a little bit. Gardner was lucky enough that we didn't have to use any of that money for revenue replacement because you couldn't use it for general fund revenue. But if you saw that something wasn't coming in as high as it used to be, or you weren't being able to fund something, or there were extra expenses because of the pandemic and you could relate that, then you could use that funding for that. But again, you have to provide all this documentation for backup. Luckily, our revenue wasn't really greatly impacted. The only hit we took was in our hotel tax, and that was to the tune of about $65,000, which out of a $68 million budget, we were doing really healthy in the end. So we were very lucky on that end. But again, there's a lot of reporting that just went on behind the scenes that we really do need to acknowledge that was a big, big task to undertake.
And Dawn Casavant, Vice President of External Affairs, Government Relations at Heywood Healthcare. I think one of the great successes was the actual labs that you set up immediately to test for COVID-19. You got the reports back, sometimes less than 24 hours, and you had hundreds of people take advantage of that lab.
So yes, thank you. Our lab department really is to be commended as well. We're a fairly small, modest-sized lab department who really undertook quite a monumental task. But setting up testing clinics locally, we felt was really important to help protect our community, to know where we're at, to know where what our numbers are. I remember the day that we tested 500 patients, from members of the community. We thought that was a big day, and then we had a landmark day where we hit 10,000 community members tested, and we are well over 30,000 plus. I don't have it in front of me, but those early benchmarks, seem to stick with you. And today, we continue it today. So we had to set up an entirely separate system for testing just to handle the volume that was coming through. It has since subsided quite substantially. Lots of providers can do that right within their office now, but we really did shift how we delivered care. We shifted our urgent cares and how they were handling sick patients and that whole communication with patients to try to drive them to access local testing. And our lab director, Dan French, I'm hoping that he is our feature on our weekly update this week, because he would be very interesting to hear from, and he can really provide you with the full experience and impact from our lab standpoint.
And Lauren Saunders, Gardner Director of Public Health, how many vaccinations were actually given out, shot in the arm for the area? from the PACC about?
Oh boy, I don't know. I'd have to pull up my data sheet. Put me on the spot.
I'm sorry.
It's
We
okay.
do know it was over 30,000.
Over 30,000.
Yes.
There it is. Thanks, Don.
Citywide, I can tell you we got a notification from the state that we are at a 99% for people 75 and above, 98% for 65 to 75. And then between 60 to 75% for people over the age of 40 to 65, and then mid 30s for all of the other age groups that are currently eligible, which that's fantastic. The fact that we can see those such high numbers, and that 62% of the entire city right now has at least one vaccine. So they're at least partially vaccinated, when the goal was to get 40. Was the governor's goal when he first announced. He said, if we can do 40, that's good. Gardner's at 60. And we hit 60 by the 4th of July, where other places are still struggling to do that. Now, our vaccine process isn't over. In fact, the CHC did get a grant from the state to do pop-up clinics in different areas. In fact, they're doing a pop-up vaccination clinic at the corner of the Food Truck Festival this weekend on a walk-in basis. But the pop-ups aren't going to get us to where we are right now. And that's what we were able to do. Everyone here should be proud of, because I can't talk about it without just beaming with pride, because we did it, and we couldn't have done it without each other.
Well, the city of Gardner and Heywood Healthcare, a huge success in the state. Paul Topolski, lessons learned. Will the state learn about this? Because the state, in many instances, I'm afraid to say, dropped the ball with this pandemic, but Gardner and Heywood Healthcare were bright lights in a dim area sometimes. Tell us about what is going to be presented to the state.
Well, as I mentioned before, we've got a emergency management directors meeting coming up, and I'm going to be speaking specifically on what the emergency management portion of it was. But when you look at how the Commonwealth of Massachusetts is set up versus most of the other states, everything is local. We do not have county government per se, and we all depend on our local communities to provide all those services that many other counties would provide elsewhere in the country. So consequently, with the state trying to be the be all and end all in the particular political setup that we have, the small regional services such as Mass Emergency Management Region 4, which is Worcester County, Region 3 being everything west of Worcester County and the rest of the regions on the east side of the state. That's a smaller entity that they have to deal with. With the regional healthcare system, as Lauren had noted, the 13 communities, that worked better than the state, because there was you didn't have to plan for everybody, you planned for your local communities, then coordinated and communicated with the other entities outside, but we had our own local planning. And I think that's where our single strength is because we are individual communities. We know what our communities need. And on a small regional basis, for example, the 13 communities in the health network, all right, we know best what we need, and trying to fit into a fits-all system like the state had, I think that's where the state can learn a lot of lessons. The more local you keep it, the better it's going to be for everybody, because you're getting those services to those local individuals on a much more defined basis than trying to do it on a statewide basis. Let the state handle distribution and the communications to those entities, and the entities will take care of the rest. And I think this was a perfect example of how that should work and how well it did work.
Well, we want to thank our panelists today on the program: Paul Topolski, Director of the Gardner Emergency Management and Civil Defense; Lauren Saunders, Gardner Director of Public Health; Dawn Casavant, the Vice President of External Affairs Government Relations at Heywood Healthcare; and Gardner Mayor Mike Nicholson. I'm Steve Wendell. Thank you for tuning in.